I'm Dr. Meenakshi. I'm a family physician and a public health person working at dcare, Chanakyapuri, New Delhi. And I would like to introduce to you a very important yet relevant topic, heat-related illnesses, which is a very preventable disease and is also life-threatening. It is very relevant to India, which is a tropical country, and for people traveling to India as well. Our normal body temperature is about 37 degrees centigrade, and there are three types of heat related illnesses that we see. There are heat cramps, heat exhaustion, and heat stroke. So, talking about heat cramps, which could normally present with a temperature more than 37 degrees centigrade, a person having acute fatigue, just tiredness, nausea, excessive thirst. These are symptoms with abdominal cramps and even cramps in the legs. This can be treated very effectively with just having cool water, plenty of fluids, about more than 3 liters would be needed, and being in a shaded environment in cool conditions. I would like you to pay a little more attention to this because this could progress to heat exhaustion. In heat exhaustion, there could be something more severe. There could be dizziness, fainting, a syncope, fatigue, tachycardia, which is increased pulse rate. There could be something like a hypotension, you fall down, that's a syncope also, and having excessive cramps, abdominal cramps, confusion, distress, sweating, cool, moist skin. There could be several factors which could be aggravating and which could be looked into and avoided. So temperature, of course, we cannot do anything much about. So we need to be in cool, shaded areas. Try not going out in the peak hours of the sun. Just avoid being in cars initially, or do not travel or commute at that time. You could have all activities later in the day, or go in air conditioned environments and move to a cooler place. Drink lots of cool water. The regulation of the temperature is done by the anterior part of the hypothalamus in the central nervous system, which is a very important part, essentially the preoptic nucleus. Also, the aggravating factors could be relative humidity, which could be more than 75 degrees centigrade, or 75% actually, and a temperature more than 37 degrees centigrade. And it could be in work related conditions, people working in mines as security guards, or in mines, or just plain policemen walking around. Anybody who's got a work shift in the daytime. We can avoid all that by using simple things like umbrellas, stop all activity in the sun, have plenty of fluids, and drink lots of things. Even Gatorade, oral rehydration solutions are good. The temperatures, if soaring more than 37 degrees till 40 degrees, we would describe as heat exhaustion, and more than that would be more than 40 degrees centigrade would be heat stroke, which could lead to even more confusion and syncope, affecting the brain and leading to encephalopathy. This all these symptoms could last for about more than a week, maybe. So we need to prevent it essentially, and because it can lead to heat exhaustion, can lead to heat stroke, we can prevent it at this point of time, and even death. So we should avoid doing excessive exercise. Athletes should not go out in the sun and be doing athletic activities, it is very important to to regulate your timings accordingly. Prompt treatment is the answer. Being in shaded places, air-conditioned environment, resting, avoiding dehydration, avoiding alcohol intake, overdressing. Your clothing should be light colored and not so heavy. The risk groups, which involve younger age group less than 4 years of age and more than 65 years of age with comorbidities. Comorbidity could be like high blood pressure, diabetes, and people who are taking cocaine, amphetamines, which are drugs, and also avoid sudden changes in the temperature, some heat index also. This could actually affect the end organs like the liver and the muscles, the kidney. So, how we're going to find out? We can test it out with a hemogram, we can do a liver function test, we can do muscle function tests, which includes creatinine, do x rays if a person has breathing issues. We can very well preventive measures take with lot of fluids, plenty, more than 3 liters of fluids per day, and also walk and be in shaded environments. Watch the medication that you're taking. Do consult the doctor and acclimatize yourself before. And also take precautions. Wear loose clothing, light color clothing, not heavy clothing, and immerse. Well, how you can prevent it by keeping your skin moist. What happens is that there is evaporation from the skin when you are sweating. However, when there is humidity, the cooling effect is decreased. So this leads to problems. The treatment, of course, uh, I'm sure you will consult the doctor, and we are always there to help you. We can give you various things besides the treatments that I have suggested, of course, and it is a preventable condition, and avoid this. This is life threatening. For any help, I will be available at dcare at Yashwant Singh Place in Chanakyapuri, New Delhi, in the afternoons, and in the mornings too, there will be a doctor available. Thank you very much.